That feeling of waiting after a fertility treatment, wondering if it worked, is a mix of hope and anxiety. You are likely eager to find out your results as soon as possible, but knowing which test to choose and when to use it can make all the difference. After intrauterine insemination, or IUI, the best type of pregnancy test is typically a highly sensitive, early detection home urine test, but only when used at the right time. The most accurate and definitive result, however, will always come from a blood test performed at your fertility clinic. Understanding how these tests work is key to getting reliable results. Both home urine tests and clinic blood tests detect a hormone called human chorionic gonadotropin, or HCG, which your body starts producing once a fertilized egg implants. Home tests measure HCG in your urine, while clinic tests measure it in your blood. The critical factor after IUI is the trigger shot you likely received, which contains HCG. If you test too early, before this trigger shot has cleared your system, you could get a false positive. That is why your doctor will usually advise you to wait around 14 days after your IUI procedure before testing. Highly sensitive home tests can detect lower levels of HCG, typically around 10 to 25 milli-international units per milliliter, giving you an early indication. Blood tests, known as quantitative HCG tests, are even more sensitive and can measure the exact amount of HCG, allowing your doctor to track its rise, which is crucial for confirming a viable pregnancy. So, when you are ready to test at home, look for those early detection brands. Always use your first morning urine, as it is the most concentrated and will have the highest level of HCG if you are pregnant. Carefully follow the instructions on the test kit. Remember, a faint line is still a positive line. But the most important step is to keep your appointment for the official blood test at your fertility clinic, even if your home test is positive. This blood test is the gold standard for confirmation and tracking. It is also helpful to know that many IUI cycles involve something called luteal phase support, often with progesterone. This can cause symptoms very similar to early pregnancy, like breast tenderness or fatigue, which can be confusing. Another insider tip: sometimes, a very early positive test can detect what is known as a chemical pregnancy, which is a very early miscarriage that might not have been detected otherwise. This is why waiting for the doctor's confirmation is so important, both for accuracy and for your emotional well-being. Choosing the right pregnancy test after IUI, combined with precise timing, empowers you with accurate information. It helps you avoid the emotional roller coaster of premature testing and prepares you for the definitive confirmation from your clinic. This journey requires patience and trust in your medical team, ensuring that every step forward is guided by clear and reliable results.